Well, welcome to Your County on Community 7 Television. I'm Veis, and I'm your host. Each month we talk about a different aspect of what's going on in Yellowstone County. And this month I'm very happy to welcome my old friend Val Weber to the program. Val, thank you so much for joining Your County today.
You're welcome. It's great to see you again.
All right. So we're going to talk a little bit about the Youth Services Center. We'll dig into what it is, what it does, and all that kind of stuff. But before we do, let's have a little background from you. Did you grow up in the area? Did you come to the area? Give us a little background.
Okay. I'm a born and raised farm girl from outside South Billings near the river. I spent most of my high school career up to college actively involved in 4-H and FFA and all those kind of farm kid kind of activities. And then got married early and started having kids and was still working on the farm and attending what was then Eastern Montana College.
We don't love to use that term
I know.
Now because it dates us.
So. I know, right? It makes me old. I always say what was then, but it feels a little dishonest to say I graduated from MSUB, but anyway. And I got a bachelor's degree in psychology and then got a wild hair to move my family to Colorado and got a master's in social work from Colorado State University. And came back to Montana because I was homesick, and I've been here ever since.
So then, what kind of drew you to working with the teenagers, the younger kids, the juveniles? What about your background kind of made you move in that area?
Honestly, I have absolutely no idea. When I was doing my clinical training for my master's, they made me have kids on my caseload because my full intention was to come back. I was going to have a really great office somewhere with plants in the windowsill and work with adults. Mm-hmm. But like I said, I was so homesick, and the only job available to me in Billings at that time was working at a place called Rivendell Psychiatric Center, which was an inpatient psychiatric center for adolescents. And I thought, well, I'll go back and do that. And I absolutely fell in love with working with crazy teenagers. So, and my career my entire career has spanned working with adolescents, and usually adolescents who are in either the Child Protective Services or juvenile justice system.
All right. So talk to us a little bit about the Youth Services Center. What is it? What purpose does it serve? And then maybe towards the end, touch on there's kind of two unique sides to the Youth Services Center. So give us a broad overview and then maybe a little bit more specifics.
Sure. Youth Services Center, Yellowstone County Youth Services Center, was renamed the Ted Lechner Youth Services Center upon the day of his retirement. Ted Lechner was the Chief Probation Officer in Yellowstone County for 26 years. And he was the person who was instrumental in creating the center. Way back in the 1970s, we used to lock up kids for anything, including what we call status offenses, which is running away, so not a criminal offense. When kids were able to successfully harm themselves, at that point they were in custody on the 8th floor of the jail in the old courthouse. Ted got together with some people because they didn't want to live with that idea that kids could hurt themselves in custody. They went around the country and they found the idea of locating a juvenile detention center specifically designed for juveniles and locating that with a receiving home for children or a shelter. And that's how the Youth Services Center was born. We were the first juvenile-specific juvenile detention center in the entire region, in about a 5-state area, and certainly the first in Montana. And at that time, they opened with 4 beds in secure detention and 15 shelter care beds. Currently, we are 24 beds in secure detention and still at 15 beds for shelter care. So that was how we came to be. We are owned by Yellowstone County, and there are statutory responsibilities that each county in Montana provides both youth shelter and provides secure detention services. So Yellowstone County owns and operates the facility, and then we collect per diems from other counties around the state. Our catchment area runs from Billings north to Canada and all the way to the North Dakota border. So we're the only facility in eastern Montana. The nearest other facility is in Great Falls, and then there is one facility in Missoula.
Okay. So as far as shelter care, are you seeing kids coming from that big of a region on the shelter care side of things? Yes.
All over the state.
All over the state. And give us a percentage. What percentage of your kids come because of secure detention and then maybe move into shelter care? And what percentage come just to seek shelter care?
About 40% of the kids on any given day are there because of a child protective issue or a treatment issue. About 60% of the kids were previously in detention, but they may also have those other issues. So they may have been in detention and then the system or the probation officer or whatever decides that they need treatment instead of going home.
Sure, okay. And then how do you guys work through some of that stuff if a juvenile arrives and they're in secure detention and they're there for the reasons they're supposed to be there? How do you guys kind of evaluate, okay, we've got this kind of under control and maybe there's some of the other issues that we're dealing with here, they're going to be better off if we deal with this over on the shelter care side of things?
You know, we look at every kid as an individual. Certainly there are some kinds of criminal offenses that will never make it into shelter care. But when we talk about more of the minor misdemeanor and kids who don't represent a danger to anyone else, we work with the probation officer, whoever's involved. Sometimes Child Protective Services is also involved. And we just look at that kid's situation and their history and just see if it's a situation that maybe we can help and what the issues they're facing. Sure. I mean, we have our own clinical people, so we provide chemical dependency services, family counseling, individual counseling, and all of it specifically oriented toward this population.
Sure.
And so we just sort, and quite honestly, sometimes we think it's a good idea and we give it a try.
Yeah. Okay.
And there's a significant amount of the time that it doesn't work out.
So a law enforcement officer is out and they find a juvenile who has, isn't doing what they're supposed to be doing, and they arrest them. Can they bring them and just put them in shelter care, or do they have to go through the secure detention side of things before they can move over?
That's something that we've developed in the last couple of years. We have two different kinds of placements like that. One is a law enforcement placement. So say Officer Jones is out in the streets, picks up a kid, there's no criminal offense, but they can't find the parents, or they can't find a responsible adult to release them to. Instead of that officer being tied up, taking care of that kid, they bring them to us at shelter care, and we spend time calling and looking for their parents or looking for someone. That's a very brief placement. We also have a crisis placement that if law enforcement feel that's like somebody needs to leave the house tonight, it's too tense or whatever, instead of arresting someone, arresting the kid, they can bring them to us at shelter care, and we put them into shelter care, and then the next business day, the youth court takes over, and a caseworker intervenes and decides what kind of help the kid or the family needs or what needs to be done. So they don't necessarily have to go to jail.
Okay. And do you get folks that are coming over to the shelter care side of things that don't come through law enforcement, that are maybe coming through a different avenue, and that there really just is no other place for this particular kid to go right now, and they need to come to you guys?
Only through Child Protective Services.
Okay.
Unlike many group homes or private operations, we are limited to a state-sanctioned placing agency. So that means the youth court or Child Protective Services places. Now, sometimes folks get involved with them, and they'll choose to place them. But we have a lot of parents call in a panic saying, "Can I bring my kid to you?" Sorry, no, can't. And usually we try to reach out to that parent at that time and help.
Yeah.
The youth court has been amazing locally. They'll actually allow us to serve kids that aren't involved with the court system yet under prevention funds. So
Sure.
we can offer those people help. We just can't take their kid for the night.
Yeah.
We also cannot take, please show my kid the jail so he knows how bad it is if he doesn't behave himself.
Sure.
We don't do scared straight.
Yeah.
Or any of that stuff. We can't. So.
Okay. Give us an idea on the shelter care side of things. What does a day look like? What does a typical day look like in shelter care?
Well, it looks like what your home would look like if you had 15 teenagers living in it. So Everybody,
I really don't want.
Yeah,
I
I know.
don't want to fathom that. But.
People usually kind of shudder at that, but we're used to it. Currently, we only have 8 kids in residence. We're under restrictions right now, but they get woke on a school day. They get woken up at 6 a.m. From 6 to 6:30 or 6:45. They shower, straighten up their room, hopefully, do the normal kinds of get ready for the day things. Then they come out and have breakfast. We have no janitorial or cooking staff, kitchen staff. It's the kids and the staff take care of it like it's a home they're living in, which is what they are. So they have breakfast, then everybody does chores. And if the chores get done quickly enough and effectively enough, they have some free time before school. Currently, all of our students are attending school on site. During other times, some local kids attend local schools, but right now, everybody's on site. We have an award-winning education program that we're very proud of, and so they're doing classroom work until noon. Then it's lunchtime. Everybody does the dishes after lunch, and then there's free time for about a half an hour, and then they go back into school for a couple of hours. And after that, it's a combination of free time or going on an outing. We try to get the kids out walking local trails, doing, especially now, sometimes it's just running for a cup of coffee or, go to one of the fast food places and get a drink or something just to get them out of the building. Then supper time, free time. They watch movies. In normal times when we can go out and do things, we try to take advantage of programs at Alberta Bear and local movie theaters and bowling and all of those kinds of things. Right now, we're having to be a little bit more creative. There's exercise built into the program and time outdoors, and we have a basketball court and a great yard. We also have our own garden that we're very proud of. We have a greenhouse. We raise our own bedding plants, and throughout the year, the kids are involved in planning what they're going to plant, deciding how they're going to eat it, how they're going to preserve it, all of that. So that's a great part of our program.
And I'm sure structured into part of that day is if they are in need of chemical dependency treatment or family. What kind of treatments are available to them during the course of the day?
So our kids are there for the most part for whatever has brought them there. So quite frankly, our therapists pull them out of class or do whatever out of whatever activity, excuse me, for individual or family therapy. So we have criminal thinking therapy. We have family conflict of whatever kinds. We have a licensed chemical dependency counselor who does both evaluations, some individual work, and we have our own chemical dependency program. We actually have the longest running adolescent chemical dependency group in Billings. It started way back in 1984.
Wow.
Right after the center started, and it's been running continuously since then. So other kids from the community and schools or wherever, they're welcome to come to that group. It meets outside of the building of the center. Just basically we tailor the therapy to the individual kid and family. We've done a lot of distance therapy because we've had such a large catchment area. So if the parents live in Glendive, it's difficult or impossible for them to drive to Billings twice a week to meet with a therapist. So we've actually been doing long distance therapy for many, many years. And so we've just sort of transitioned into that right now.
Are there any other maybe specialty stuff that you guys don't have in-house where the kids got to go somewhere to take this particular class or therapy or whatever it is? What are some of those maybe examples of something that's pretty specialized?
The only thing that comes to mind in that would be sexual offender treatment. So we don't take like newly diagnosed or charged or anything youth with offending issues, but we frequently are involved in transitioning those kids back to their home communities. We only take one at a time, so because we feel like we can't manage more than that, but they do attend at a locally well-known offender treatment program, and with a high degree of structure and all of that. But they've already been through a major treatment, and it's more of a transition. We have transitioned some kids to independent living. We have, some of our kids historically have had jobs, the ones that have been with us for a pretty long time.
Yeah.
The average length of stay in shelter care is only 14 days.
Right.
But some kids, given their circumstances, can be there for months.
Sure.
And so we've transitioned them into those kinds of
Right. So if you've had one who's been there for a while and they're probably coming up on their 18th birthday, and you just know they're not.
Right.
They're not this is not going to happen.
Right.
So walk us through some of the steps then that you're going to do to transition that person kind of.
We try to first get them some money in the bank, get them working, teach them how to save their money, get them to figure out what they're going to, need to live, to pay rent. We do try to get them hooked up with various programs in Billings that work with kids in those circumstances. We try to get them connected as much as possible. And then we sort of gradually get them into being more independent. So in the beginning, we take them to work and then bring them home. Over time, it's like, well, maybe let's get you a bicycle.
Yeah.
And get you to back and forth to work, and we teach all of our kids in normal times how to ride the city bus.
Yeah.
It's an important skill, how to get around.
Yep.
And just a lot of monitoring and helping good decisions.
Yeah.
A lot of the kids just have not had the opportunities to learn those skills when they were young. And so it's a crash course, if you will, in setting goals and keeping them and making good decisions.
Sure. Let's talk a little bit about COVID. That's kind of what's on everyone's mind. Give us kind of some of the background. I'm sure you saw you had this time to come in, and it's not, some probably small percentage of kids that come your way have a choice to be there,
right.
But the vast majority do not have a choice to be
Correct.
there, which then puts their health and safety incumbent on you in the facility. So.
Right.
Walk us through what you were thinking about as this pandemic was coming on, and how you guys were going to have to deal with this, being in charge of juveniles who, for the most part, do not have the choice whether
Right.
to be there or not be there.
What I always tell people have always asked me throughout my career, how do you work with those kind of kids? How do you stand to be around those kind of kids? The issue is, on any given day, if you aren't paying attention to anything else, that kid is no different than any other kid. They're really not that much different just to talk with them than a kid I meet at a 4-H meeting or anything like that. And my fundamental guiding principle has always been one thing and one thing only. I'm responsible for taking care of other people's children. And that includes the community safety aspects of it and everything. But those are people's kids, and I'm responsible. So when COVID hit, I did what I've always done with things, especially new things, is did a lot of research. It's been difficult and challenging because the research with a new disease has evolved. So early on, we actually started on mandating masks inside the facility all the way back to March 1st. Prior to that, it was kind of a voluntary thing, but since March 1st, we have worn masks. We implemented specialized cleaning protocols. We always clean a lot, but these are, the cleaning high-touch surfaces, and doorknobs get cleaned multiple times a day and things like that. Socially distancing within the building as much as possible. There's been a significant change, just like in the adult system, with the kinds of kids that we will put in jail. Most of those kids, historically, more than 60% of the kids in the Youth Services Center detention facility were in and out in 24 to 48 hours.
Sure.
So for those of us in the system, we pretty much made a decision that unless the kid represented a significant danger to the community, that we were no longer going to detain those kids, that we just weren't going to expose everybody for 24 hours of detention. For someone
who's going to be there for 24
Right.
hours, why even bring them through
Right.
the door?
So we just don't do that when we haven't done that for a while. When a youth is brought in, though, they're generally kids that are going to stay for a while, and those kids go into automatic quarantine. At one point, it was 8 days. Now it's back up to 14 days. We do have a testing program, but the testing historically has been difficult to obtain. Right now, we're doing pretty good with testing. But any time in that 14-day period, if you test them on the third day after they're brought in, they could still convert to becoming COVID positive. So we just go with quarantine. Now, when they're in quarantine, they still get staff attention, they still get education, they still get everything that they get. They just get it separate from other kids and as distanced from staff. Shelter care is pretty much the same way. Shelter care, we dropped our capacity to 50% so that kids can have their own rooms, and they quarantine. We are doing, as I was leaving today, we were on our 3rd meeting with a social worker that was happening remotely. So we use Teams and Zoom and all the different kinds of platforms, and kids see their therapist, see their psychiatrist, see whatever through distance meetings. Most of our court cases are done remotely. The courts around the state had already been doing a lot of that before this hit, and now it's pretty much exclusively that.
Sure.
Except for some of the real heavy-duty cases.
Yeah. Now, what about on the staff side of things? Also, it doesn't probably work for your staff to work from home.
No, not at all.
That's
not an issue.
Again, not going to probably be an option. So what are some of the staff protocol that you've had to put in place then as well? As someone who, if I'm going to work, I got to come into the building.
Right. Everybody is masked all the time. Everybody, they try to social distance. We have, say just a shift change meeting where we normally had a very small office where all the staff gather, the ones that are leaving and the ones that are coming on, and they would meet. We now meet in a different place so they can stay separate. Lots of cleaning, lots of a lot more attention paid to health issues. We have been very fortunate to become partnered with Flex Family Health as our medical provider. They do incredible work for us, and they're available to the staff, and so the staff have been just much more careful and cautious about their own health, about the kids' health at work, and we're muddling our way through. So far we've done really well. We've only had one youth case this entire time. It was a very mild case. And in fact, it was discovered in a mass testing.
Oh, okay.
He was already not symptomatic by the time that happened. And we've had 2 staff cases other than that. And so we're doing okay so far.
We're doing okay. Have you been able to talk to any of the other detention facilities, colleagues, stuff like that, to kind of compare and contrast, and what are you doing that works and what are you doing that doesn't work, and what have you learned through that process as well?
A little bit with detention, but mostly I have a monthly group meeting with other youth congregate care facilities, other group homes around the state, and treatment facilities, and so that's been incredibly helpful. The state health department nurse sits in on those meetings with us, and so she's been very helpful to us. The state people have been amazing, locally as well, but locally they've just been so darn busy. The state folks being with us in this meeting, it's a time every month where I know I can get my questions answered. And they've also provided us with all the testing, which has been really, really important. We could not be as safe as we are if we were having to pay for all the testing.
Sure.
So that money has been, the testing availability at no cost to us has been a really important part of it.
Sure. What have you learned about the Youth Services Center that you didn't know pre and post pandemic?
That my people will rise to the occasion, pretty much no matter what.
Yeah.
I've also learned that we expect way too little of kids, and we sort of assume that kids aren't going to do certain things. I remember reading lots of comments in the community and everything about the kids going back to schools and having to wear masks and things like that, and it just really hasn't been that much of an issue for our kids. It's just become a normal part of what they do. When you come out of your room, you put your mask on. I just think, I think we've learned a lot about ourselves as individuals and as a group and as an agency. This has happened in a time of significant change at the Youth Services Center. We've got a number of people retiring.
Yeah.
A lot of the old guard is left, and you got new people in, and that can feel kind of scary, but it ends up being a good thing. It ends up bringing new energy. This has been a real challenge to the people inside the building, people outside the building, the community, but again, I'm just really glad that people have stepped up and have been willing to learn. And the underlying principle of the Youth Services Center is that we maintain the safety of the community by caring about people. Our mission literally says that we care for youth and families. So that mission has been enacted in the time of COVID by us not contributing to the pandemic, by us letting parents feel that even though their child isn't in their house, they're still safe, and they're safe from the virus. I've had a lot of conversations on the phone with scared parents about how we're taking care of their kids, and I've been really grateful to be able to tell them how we're taking care of their kids, and to tell them that we haven't had lots of sick kids and that we're taking care of that every single day.
Sure. With that in mind, maybe zoom out a little bit more, but what do you see coming for Youth Services Center over the next 3 to 5 years? I know you've had a lot of staff turnover, and I know right now a lot of people are just focusing on getting to the next day. But if you could give us your best guesses, what do you see coming down the pipe? What's going to change in the next 3 to 5 years?
I think we're going to continue to reevaluate the nature of traditional human services. I think that this has provided all of us with an opportunity to see the value of remote services. You know, like I said, I'm a farm girl. I have family all over eastern Montana. I don't think that those of us in Billings generally have had a full appreciation for what it's like for somebody to get in their pickup and drive 150 miles to a therapy appointment because they have a troubled child.
Yeah.
And what that means. I think that this has started a new evolution of health services in general, and I think certainly with kids. I think the other thing is that it's really reinforced and is going to continue to improve the importance of the interagency relationships of the people involved. Like, I know that pretty much every youth probation officer in the state that brings kids to the Youth Services Center not only has the center number, but has my cell phone number. Now, they and us have always known how important those relationships are. But I think at the level above us, at the agency level, at the county and state level, those relationships and the importance and functionality of those relationships have been renewed by the people that are in the decision-making roles. So it's not just something that happens on a day-to-day basis.
Yeah.
It's actually going to be more built into policy, I think, as we go forward.
All right, very good. Val, it is always a pleasure to have you
Absolutely.
on
Thank
here.
you.
Thank you for all that you and your staff do, taking care of kids in Yellowstone County. I guarantee you it's not an easy job, so thank you for doing what you do.
Thanks for having us.
You bet.